All right. Good evening, everyone, and welcome to ATP Live Monday. I hope you had a good day. I'm Bimisela Boyde, and it's my pleasure to be here today for this episode of ATP Live Monday, where you get to ask any questions that you may have about the health of your children and get immediate answers live from the pediatrician. So thank you so much for joining us. And I want you to help us share the videos to all the various platforms where you are able to, and so that we can all um, watch it together. So if you have parents, friends, family members who may have questions for your pediatrician, this is the time for you to share. And I'm going to do the same as well. Share to all my platforms, and then we can start. So, welcome everyone. Welcome. And if you have any questions about the health of your children, um, feel free to share it now. Feel free to start dropping your questions on whichever platform you're watching on Facebook page, Instagram, live, YouTube channel. You can drop your questions. If you're watching on our groups, you will have to click on the video to drop your questions so that I'll be able to see them. Please, as you're dropping your questions, try and start with the age of the child. That is the most important thing for us to know how to answer your question. Please give us the age of the child and tell us in concise summary what your concern is with the child so that we'll be able to address your concerns. So, welcome everyone, and I'm also just making sure I share the video and the link, and I'm pinning it to all the places where it should be pinned and making sure everybody can see, everybody can hear. So just give me a couple more minutes to finish that, and then we can start answering the questions. For those on Instagram, thank you so much for joining us. I see you. Thank you. Um, I'm just going to make sure I pin the videos, then we are good to start. Thank you. Just to remind you, ATP Life is brought to you by Ask the Pediatricians Foundation. Ask the Pediatrician Foundation is a registered nonprofit in Nigeria. We are committed to the health and to the well-being of all children globally, but especially in sub-Saharan Africa, where most of our children are still dying from preventable, treatable conditions. So we do that through our health education information platforms online, and we also do free community medical outreaches and even in schools. So that's what we do, and we welcome you to be part of it, either as a volunteer or as a donor. I mean, and you can trust that whatever money you give to us will be spent in taking care of the children in the most indigent and vulnerable communities in the world. All right, I think I'm done with all my sharing and pinning and all that. So let me once again welcome everyone to ATP Live Monday. I am Baby Stella Boyd. I'm a pediatrician and CEO Ask the Pediatricians Foundation. And I'm here today for the next 1 hour to ask any questions that you may have about the health of your children. So feel free to start asking your question now. Um, Housekeeping rules, please always start with the age of the child. Very, very important. If you're asking us about the weight of the child, please try and tell us the birth weight and the current weight or other information you may have. Try and be specific and go straight to the point that are relevant to the question so that else Facebook may actually cut off your post in the middle. All right, so thank you so much. I'll check out start with Instagram. I can't see any question on Instagram yet. So if you have any question, Instagram family hacks, because your questions are rolling and can disappear. So, but I have a question already on Facebook from Temitope Ajayi Edema. Okay, thank you for all you do, ma. You're welcome. Please maybe gradually stop eating, and it's only taking breast milk now. Is 1 year 3 months. So can I use bandage to wash his mouth? It's not easy using brush. Okay, thank you, ma. All right, thank you, Temitope, for your question. So your baby is 15 months old. Definitely breast milk is not enough for a 15-month-old at all. So from the age of 6 months, breast milk is not enough. So that child needs to eat, and there's no reason why a 15-month-old should not be able to eat other food except breast milk. So I don't know whether the child was sick or what really happened or what kind of food were you given before. But definitely this child needs to take more than breast milk, or else that is a recipe for malnutrition. So I don't know what is your baby's current weight. So if you have that information, it would be nice for you to tell us the current weight of the baby. But definitely the child needs more than breast milk at 15 months to survive. So if I don't know what you've done, but I can recommend that you go to our Facebook group and go to our guide section. We have lots of videos on how to go about complementary feeding. We have lots of tips on complementary feeding. You may want to start from there. You may also want to see a dietitian, a pediatric nutritionist. They can also give you some support around how to feed your child, depending on what kind of food have you been offering the child. I hope it's not just pap and all those cereals in the stores. The child, a 15 months old, should be eating everything you are eating in the house, everything you have in your kitchen. So you may want to start with that. But if you go through those videos from Global Health Media on our guide section, you'll have clarity on the kind of food to give, how often to give, how to present the food. But the child definitely needs more than breast milk at 15 months to avoid malnutrition. That is number one question. Yeah, your second question is how can I use bandage to wash the mouth? So for a 15-month-old child who has teeth, you should use toothbrush, not bandage, not cotton wool, not clothes, not water. You should use toothbrushes. Okay, so there are soft age appropriate toothbrush, and you should use toothpaste that has fluoride inside. So that is how to clean the mouth. We have articles on our website, on our Facebook group on how to brush teeth for toddlers, and there are lots of videos online as well, all these cartoon on brushing teeth. So you may want to show the child, and then you may want to get two brushes, allow the child to have one and you have one, and then so there are lots of tips that our dentists have made up on how to brush teeth for toddlers. Definitely, most toddlers don't like brushing their teeth. That is normal for them. So, but there are ways by which you, as a mom, can help them to do it. So, you may want to check out some of those tips, and it has to be the toothbrush and the toothpaste, not bandage or cotton wool or any of those things. So, I hope that is helpful for you. All right. If you have any more clarity on your question, Temitope, feel free to ask if you are still listening to me. I got two questions on Instagram. I'll go to them quickly, then I'll come back. Gift Blessing saying, hello, doc. My baby of 14 months has not walked, but she hold the table to walk around. Okay. I guess you're asking what to do. Please always ask questions. Don't just leave information and leave it hanging, because I'm not really sure what's you want me to do with that information. But if I assume, which I don't like to do, but I'm going to assume you are trying to ask whether you should worry or whether it's normal or not, I'll just say we don't worry if a 14 months old is not working. We will worry about it if baby is 18 months and not working. And if the child is already cruising around the table, which is what the child is doing. The child is walking around the table and cruising. If the child is cruising, then it's just a matter of time for the child to walk. So I would just say just be patient and watch for now. So, but by the time your baby is 18 months, if the child is still not walking independently at 18 months, then you can see a pediatrician, because that is when we will say the child has motor delay. Some Most children walk at 1 year, but some children walk a little bit later, and it is still within normal. So we only start to get worried at 18 months if your child is not walking at 18 months. So give blessing one. I hope you are still there and you got that question. And then Reem Dom, my 2 year 5 months old doesn't chew anything. It's really a big stress for me. What do you do? Well, why is it a stress for you? Is it stress for the child? It's not about you, it's about the child. So the most important thing is it that are there food that the child cannot eat because the child is not chewing? So what we normally recommend is that first make sure that the child's food are soft. Make sure you cut them in tiny pieces so that the child does not choke. That's the most important thing for this child as a 2 year old. Then number two, you want to start encouraging the child to chew, and it doesn't have to be always with food. You can buy the child some toys or things that will, the child can chew on. That will encourage them to practice chewing, and that's okay. You can start with that so that when the child now has food, then the child can chew on it. But you child can see solid food without chewing. You don't always really need to chew all your food to eat them or to digest them. All right, so but it's something you can begin to work with the child on. But the most important thing is while you're working on that the child is safe and the child is not taking something that will shock. So you want to avoid seeds, you want to avoid big lumps of food, you want to make sure the food are soft, they are well cooked, they are cut into tiny pieces for the child to be able to eat. I mean, to be able to take them without necessarily choking on them. But more importantly, you can begin to encourage the child to chew on things that are toys that the child can chew on and things like that. And as a way of practicing, if you really need much help with that, you can see the dentist as well. They can also give you more tips on that. But personally, we are not worried about it as long as the child is able to eat their food and they are not choking on it. So that's where we will say. All right. Okay, let's go back to Facebook. Adeflurek Bimisola, my namesake. Say thank you, doctor. God bless you. Okay, thank you. God bless you too. Then Temi Tokpe Hajayi. Say your baby is 9.8. Okay, that's your 15-month-old. So 9.8 kilo is not a bad weight, it's good. We're not worried about the weight. He has lots of appetite. And so if the child was eating before and the child suddenly stopped eating, then something is wrong. It could be that the child is ill or the child is sick, or so you really need to see a doctor so that they can be able to work it out for you and then they can provide some support. All right, so I would recommend you do that because it's not usual for a child who is already eating before suddenly should just stop eating completely. So we need to know whether there's something going on and what we can do about it. All right. William Mary, good evening, doc. My baby's breasts are big. How old is your baby? 10 months old. No massage, no pressing. Please, can it be number? Yes, some babies have enlarged breasts from birth, and usually it's due to the effect of the mother's hormones. So the same hormones that working in mothers to that will make your breast be big and prepare you for breastfeeding. The same hormone gets into the baby's blood and it can make the baby's breast to be big as well. So but we expect that once the baby is born, the mother's blood is no longer mixing with the baby's blood. So most of those hormones they will kind of clear off from the blood, and so over time the breast will get smaller and there'll be so it's nothing to worry about. I'll just say leave it alone. I think most parents just are so um worried about it, and most parents just kind of stress over it because we tell you not to worry, and most of you want us to tell you when exactly to go back to normal, which we can't because it varies from one child to another. But one thing we know is that it's going to go back down. The most important thing is that you don't press, you don't massage, you don't do anything to it, because that's what some parents do. And in that process, they introduce germs and infection, and then it becomes what we call breast abscess and mastitis and all that, and that will now need treatment with antibiotics, even minor surgery to remove pus and all that. So just ignore it, just leave it alone. It's going to go back down, and you don't need to do anything about it, and it's going to go back down on its own. So just leave it alone. Please don't get yourself unnecessary worked up over it, and don't listen to people who are telling you to do this, do that. Don't listen to them. Just leave it alone, and the breast will go down to normal over time. So I hope that is helpful. All right, so we're still on ATP Hour, sorry, ATP Live Monday, and this is a platform where you can ask any questions that you may have about the health of your children in the next 1 hour, and I will try my best to answer them. But if you are joining us and this program is already over, say you're joining us from around after 7 p.m., uh, please, you can still post your questions to our Facebook group, Ask the Pediatricians Facebook group. We are there 24/7, Mondays to Saturdays, to answer your questions. So don't feel like, oh, the pediatrician is gone, I'm just coming. For those of you who are watching the repeats or the recording, I'm just trying to let you know that don't worry, you can always post your questions on our Facebook group, and somebody will be able to answer the questions for you. All right. So thank you. All right. Instagram hacks a question, but let me go to Facebook. I've got a long one. So Aisha Motunrayo saying, "Good evening, ma. Please, I listen to your program on malaria. Oh, thank you so much for listening. The causes, symptoms. My problem is that my son do not have fever. My son do have recurrent fever. In fact, now up to a month interval. And anytime we see the hospital, they did test for him. It's always negative, and he'll be having high temperature, which can lead him to convulse. Please, doc, what can we use for this recurrent fever? He only convulses with high temperature, and I make sure he sleeps inside nets." Okay, so thank you, Aisha. So thank you for listening to the recording on malaria, and that's just to let other people know that every Thursday we have our ACP Hour, which is a program where we discuss topical conditions. So you can always listen to that as well. In ACP Hour, we actually take a particular topic and go into details on it. So you can watch it on Facebook. And you can watch the previous recordings as well on Facebook. You can also watch it on YouTube channel ATP TV, or you can also listen to it on Ask.Ogbemi ATP podcast. The podcast is available on most podcast platform like Stream, what's it called? Spotify, Google Music, all the just search Ask.Ogbemi ATP podcast and you will get to that. So back to Aisha's question. So if your child is having recurrent fever, please don't assume malaria. Malaria does not cause recurrent fever, okay? If your child is having fever almost every month, the said it's not even up to 1 month, and this child is always having fever and having convulsion, we call it febrile convulsion. That is not malaria. Every fever is not malaria. I hope you get that from that teaching on malaria, because I think most of us Nigerian mothers, we just think fever is equivalent of malaria. In fact, we tend to use it interchangeably, and some people say malaria fever. So please, fever just means the child's body is hot, and it is not every fever that is due to malaria. There are so many causes of fever, and I'm happy that your doctors are doing the blood test and it's coming out negative. So if your child is having fever several times and it's always coming and the malaria test is negative, that means the child is not having malaria, and you already said you are taking precautions, sleeping under net. So this child is having fever for another reason. So it is important that you see a pediatrician to know why your child is having fever almost every month. or every 2 3 weeks. That is not normal. It is definitely not normal for your child. You didn't tell us the age of the child. Always put the age of the child in your question. You didn't tell us the age of the child, but it's definitely not normal for any child to have fever every month or every few weeks. It is never normal, and it is definitely not malaria. So the most important thing to do for your child is to know, why is your child having fever. You really need to know. We need to know, answer that question. And we're not going to answer that question by doing malaria tests. There are several other tests that doctors will do. There are several other investigations that we will do to know why your child is having fever. In fact, we have what we call fever of unknown origin, fever that happens, and even from the common tests we do, we don't know the cause. So we call it fever of unknown origin. And then we have to now go and do all the details, all the rare, tests that we don't do every day. We have to do it in those cases to know why is the child having fever. We may sometimes have to put the child in the hospital. We may need to do so many tests, urine tests, do blood culture, do so many things. These are things that your doctors will not do every day when you go to the hospital. So this child has to see a pediatrician. You may even have to go to like a general or a teaching hospital where you have more specialists, pediatricians, so that they can investigate your child properly. Sometimes we do bone marrow tests because some children have cancer and the only thing they will have is fever and fever and fever. So we have to do all these things to rule out all those causes of fever that are not so common, so that we can address it. And then now that your child is also having fever and convulsion, we also need to address the fever and convulsion. We call it febrile convulsion. There are ways by which we can prevent it as well. So that each time your child is going to have fever, there are drugs you have to start giving your child straight away, so that the child will not convulse. Because if your child keep convulsing every time the child is having fever, that is also not a good thing, and that can be dangerous, and that can lead to other problems. And we don't want brain damage and all that, because sometimes if the conversion can go on for too long, and if the conversion goes on for too long, the child is going to oxygen is not going to get to the brain, and the child's brain can become damaged from that, and that child can now develop disability in future. So this child has to Aisha, your child has to see a pediatrician, preferably a pediatrician in a tertiary level of care in a teaching hospital. They should not just don't go to hospital where they only tell you malaria or they only testing for malaria. They have to investigate your child for all the causes of fever that are not so common, and we have to address it, and we need to deal with it. Otherwise it can be dangerous, because your child is having fever and convulsion, and that is not good at all. So I hope you will seek help in the right place. So that's what I'll advise for Aisha. I hope you got all that, and I hope you are still listening. If you want more clarity, please ask. All right. So if you have any more questions, feel free to ask. I have more questions here from Ingene Igwe. Good evening, Doc. My baby had jaundice at birth. It was treated. He's 8 weeks old now. He can track objects with his eyes. He has a social smile. Any need to be worried? There's no need to be worried. Why are you worried? Okay, it's not every jaundice that will lead to brain damage. Okay, it's not every jaundice. Depends on how bad the jaundice is. Okay, you didn't tell us that. You didn't tell us how the jaundice was treated as well. So, if your baby has severe jaundice, I would expect that your doctors will follow up the child. We won't just discharge the child and that will be the end. They will actually give you appointment for follow up, and they'll be monitoring your child. So if they didn't give you that appointment because they are not thinking it's a severe jaundice, or they are not worried about any brain damage, then there's no reason why you should be worried as well. So no need to worry at all. So if your child development is fine, that's okay. But if your child has severe jaundice, like they have to exchange the blood of the baby and all that, your baby has to be kept in the hospital for so long, they have to change the blood especially, then your baby has to be followed up by a pediatrician who will now be the one to monitor and to check whether your child is having any brain involvement. But from what you've told us so far, your child's development seems to be age appropriate, and I won't worry about that. But like I said, I've put a caveat there so that if your child has severe brain severe jaundice, then that child has to be followed. We usually will follow them up for 2 years minimum before we can now say, okay, everything is fine. If after 3 years there's no concern, then we can say everything is fine. All right. So, thank you so much, everyone. I don't think I have any question pending. Instagram people, feel free to ask questions, and those on Facebook, feel free to ask questions as well. If you're on our Facebook groups, you have to click on the video to post your questions, because some of you drop your question directly on the group and it's difficult for me to see those ones. So I'm just checking now. And then okay, so but if you have questions, click on the video, then drop your question directly under the video, and then I'll be able to see it. Okay. And if you're watching after we've gone offline, that is, the program is no longer live, then feel free um to ask your question on our Facebook group. All right, let's go on. Yahweh's Pride. Can I forcefully stop my child from breastfeeding? Okay, so please always start the question with the age of the child. I think I've said that like a broken record now. The most important information a pediatrician needs is the age of a child, because everything is age related. So every advice we give is age related. And I'm not sure why you have to force a child to stop breastfeeding. I mean, what is the issue here? So tell us the age of the child. Your child is 2 years. Okay, if your child is 2 years, you can wean the child, but I don't think it's a forceful thing. Why do you want to make it forceful? Just wean your child. But what we recommend when it comes to weaning is gradual weaning. So you gradually reduce the breastfeeding, because we expect that your 2 year old should be on, all the family food. Your 3 year old should be eating everything the family is eating, and then you can begin to stop. You can stop breastfeeding. You can breastfeed beyond 2 years, no problem. But if you at 2 years, you are welcome to stop. I mean, we also agree with you that it's okay to stop at 2 years. So what you need to do is to stop the breastfeeding. You can decide to, I don't know what you're doing now. If you're breastfeeding all through the day now, you can decide that you won't breastfeed in the daytime, in the morning, in the afternoon, after the child is, able to eat and all that. Then maybe breastfeed only at night, and then the nighttime, gradually you can just stop it. Maybe one weekend you want to have a crisis, stop, then you just stop. And so, and that's it. So just make sure the child has alternatives. Some children are going to cry and all that, so there's you can work with them. And some people will say, "Oh, I'll take my child to the grandparent for 2 weekend or something," and then but there are tips, and then you yourself you have to make up your mind. I actually find that the most important thing in all the tips is for the mother herself to be psychologically ready to stop breastfeeding. So it's not forceful. If your child is 2 years and you want to stop, you can stop breastfeeding. I won't call it forcefully stop. You can stop the breastfeeding, and then you can gradually, but you can just do it the way that works for you, and there's nothing wrong with that. Just make sure your child is eating other food well, and that's it. And if you need more tips on how to stop breastfeeding, we have those tips on our website. If you go to our website, you will see a lot of tips on how to wean off your child of breastfeeding. So I hope that is helpful for you. All right, I think I have a question on Instagram. Rimdon say your 5 year old is always having stomach pain. What can I do? Okay, the most important thing is to know why your 5 year old is having abdominal pain. It's not normal for a child to be having abdominal pain all the time. So you want to take the child to the hospital first. When you get to the hospital, they will investigate the child to know why the cause of the abdominal pain. Where is the pain? There are like 10 questions they will ask you about the abdominal pain. Where is the pain? Is it always there? Does it come and go? Is it related to food? What makes it worse? What makes it better? If you've been to hospital, we ask you all those questions, because those kind of answers will help us to know what is causing the abdominal pain. and then we can now advise you. Also, the doctor will have to examine the child. Is there anything swollen in the tummy? Is there any, when we touch the tummy, does the child feel pain, or the child does not feel any pain when we touch the tummy? So these are things that doctors will do, and after doing that, then they'll be able to tell you if they are able to find the cause of the abdominal pain. Sometimes there's no cause, there's nothing wrong. We need to make sure, is the child constipated, is the child moving their bowel, because that's the commonest cause of abdominal pain in children, constipation. They are not going to toilet regularly, so there are a lot of stools there, so we need to further deal with that. Some children is urinary tract infection, you know, we need to deal with that. So the doctors will look at all the common causes. Some children is food related, so they will deal with that, like peptic ulcer, all those Bacter pylori infection. There are things that doctors will look out for, so they will deal with the cause of the abdominal pain. But so some children will do all this investigation, will do all these physical examination, ask all the questions, examine the child, do all the common tests, and we still don't find any cause, and the child is otherwise well. Then we want to look for things like, is it pain during the school period, or is it only during the holidays? Is this child having abdominal pain during holidays or only during school? Because sometimes some children have anxiety, especially when it is time to go to school or to do something, and the only thing they will tell you is that they're having abdominal pain. Or some children don't want to eat food and they will tell you they're having abdominal pain. So something, there's what we call functional abdominal pain. There's actually nothing wrong with the child. There's nothing wrong with the tummy, but the child, for one reason or the other, is saying, I'm having abdominal pain. So for those kind of children, then we want to figure out what is the underlying problem, and then make sure the child is not being bullied at school or things like that, and we deal with it. So that is the most important thing to do. You need to know why the child is having abdominal pain, and if there's something, that there's nothing, and you just leave it alone and try and make sure there's no other reason why the child is having abdominal pain. So some children, it's because they are anxious about something, they don't want to go to school, or somebody is bullying them and all this kind of stuff. So you need to deal with that. So that's what you need to do. So if you have gone to the hospital and nothing is found, then most likely it's a functional abdominal pain. But make sure you go to the hospital and see a pediatrician. You have to see a pediatrician, because not every doctor can deal with things. A pediatrician will have to do everything, make sure everything is sorted before telling you there's nothing wrong. It's not just one soft thing, and sometimes you may even have to see the specialist, what we call the pediatric gastroenterologist. Those are the specialists when it comes to tummy, anything related to the abdomen and all that. So you may even have to see this kind of pediatrician, not just the general pediatrician as well. And sometimes they do some endoscopy. They do other tests that are not so common in children before they will say there's nothing. So it is after you've gone through all that before you can say there's nothing. And once you've gone through all that, there's nothing, then okay, we can agree that it's a functional abdominal pain. You don't need to do anything about it. Hopefully the children will stop complaining of the pain after a while. So that's what I'm going to recommend. But let's not be quick to dismiss it and say there's nothing until you've actually seen the right specialists and they've done all the needful investigation in your child. So that is when we can say there's nothing wrong. Okay, so I hope that's helpful. All right. I don't have any question right now. So, but again, just to remind us that if you have any questions after 7 p.m. or after we're no longer on the live session of this program, not to worry, go over to Ask the Pediatricians Facebook group and you can ask your questions there. Give us some time. Sometimes it takes us 24 hours, sometimes 48 hours, at least most by 72 hours. We would have answered all your questions. So be patient with us. Of course, if your child has an emergency, you have to go to the hospital. There are things that are pediatric emergencies. They are not for us to post on Facebook or Instagram. They can't wait. They are not for us to post on our website. These are situation where you have to take that child to the hospital straight away. So anything that has to do with the airway, the child is having difficulty with breathing, the child is having obstruction, the child has swallowed something, something is blocking the airway. So that child has to go to the hospital. Please don't come and be asking on Facebook, okay? The child is not breathing, or the child suddenly stopped breathing. You have to go to the hospital. Or the child collapsed, the child passed out, the child fainted, or the child is having convulsions. So those are not, I'm going to ask on ATP kind of questions. You have to take that child to see a live pediatrician, a real pediatrician, or face to face straight away. Usually you may have to go to emergency room. The children are taking poison, maybe they swallow too much, some drugs, we have to make sure we keep drugs out of reach of children. But if we have left it carelessly, no matter what the drug is, you have to go to the hospital. You take the drug packet with you, and that is an emergency. You have to go to the hospital. The child has had an major accident. They fell, from maybe somewhere. They split their lips open. They cut something. They are bleeding actively. You have to take the children to the hospital. That is not Facebook thing. All right. So these are pediatric emergency. Child is convulsing. It's a pediatric emergency. You have to take the child to the hospital. So ATP, we have on our web, we have a first aid care link. We have a course on it. We have a booklet on it, and we have the one that you can have handy as a mother. What do you do in this case? What do you do in that case? Even and all that. So I recommend that we all get it. We've been going to our secondary schools and we've been giving it to our children. And in the secondary school, we're empowering them to know what to do in case of common medical emergencies. What do you do? Somebody is collapsing, somebody is having an asthmatic attack, somebody is having a convulsion, somebody's nose is bleeding. What do you do in such instances? So ATP, we've been on the forefront and we've been trying to empower our secondary school students with this information. So I really encourage us as parents to know what to do in case of emergencies. And if you need those information, ask on our Facebook group. We will signpost you to our link for them. I don't have the QR code now. I would have shown it, but I'm sure if you ask, we'll share it with you. All right, I got a question on Instagram. Oluwamayo Mikun, please, do we have preventive malaria drugs for children? No, we don't. We don't. I know in those days when I was growing up, as a child, we have what we call Sunday medicine. We have medication that we give that you have to take every week. Daraprim. I'm sure most of you are familiar with Daraprim. For those of you who were who were in the 80s or 70s. So we were giving it to children then to prevent malaria. Actually, we stopped doing that now. So we don't give drugs to prevent malaria. For most children, we don't. However, there are exceptions to that rule because before somebody will say, Dr. Baby, but so there are certain children that will prevent malaria in them. Our children who have got sickle cell anemia, sicklers, we tend to prevent malaria in sicklers because malaria for them can trigger off a crisis. So for them, we give them Proguanil, or Paludrin. We give them every day for the rest of their lives. They have to take that Proguanil, or common trade name is Paludrin. They take it every day. That's for children who have sickle cell anemia. So we don't, but for other children who don't have any other thing, we don't give them drugs to prevent malaria. Two, there are places where they tend to have malaria during certain seasons. They have malaria maybe during the wet, rainy season and all that. So we do what we call seasonal malaria chemoprophylaxis. So you see the health workers, they will come to the house for children within 3 months and they will give them 3 months and 3 years. They will give them these like fancy that, and they will give them every month during that period. So we call it seasonal malaria chemoprophylaxis. So that is not something we do everywhere. We do it only in certain places where there's period of where malaria is likely going to happen. And so we kind of give those children drugs around that period to protect them against malaria. So we actually do that. But majority, if you are not living in those areas and your health centers are not giving you, usually it's mostly in the northern part of the country anyway, in Nigeria, you don't have to give any other drugs to your child to prevent malaria. Okay, so please don't give drugs to children for malaria, because we actually want children to be exposed to malaria. We want them to develop some certain, because most of us in Nigeria, we have what we call semi immunity to malaria, because we always have malaria from time to time. So our body, so people say I have malaria, but they are still going to work. They have malaria, they are still working, they are walking around the house. Whereas people in maybe UK or US, for example, if they have malaria, it's a serious illness. They are in the hospital, they are on admission, they are taking drip and drugs and stuff, because they will have severe malaria. But those are people who live in what we call malaria endemic area. We Our malaria is tends to be simple. So most of the people have malaria and they are still going to work. They are taking their malaria drugs, they are still going to work, they are still doing everything, they are still moving around. So they, because we have some level of protection against malaria. So we tend to have simple malaria, we don't tend to have severe malaria. Whereas somebody who fly in who just came into the country, for example, if they have malaria, they're going to have severe malaria, they're going to be very sick, and they can even die from it. So those are the people that, if they are coming into the country, for example, we have to give them preventive drugs so that they will not have severe malaria and all that. So so we want our children to develop some level of immunity against malaria. So it's okay for them to have some malaria by not giving them drugs, so that when they eventually have malaria, they're not going to have the severe kind of malaria. But hopefully, we are working hard to get what we call malaria vaccine. Malaria vaccine will soon be available for children less than 1 year, because those are the people that we worry about, the pregnant women, the children less than 5, and all that. So they will be targets for the malaria vaccines. So the government is about to introduce that. So hopefully very soon we'll have malaria vaccine for those children, but not drugs to prevent malaria. I hope that's helpful. Okay, I got a question also on Facebook. Temitope again. How can one check a choking toddler while eating? How can one check help? Okay, help a choking toddler. So if somebody is choking, it's an emergency. We need to know what to do in an emergency, depending on the age of the child. Usually for the infants, what you need to do is to put them on the back of your hand and give them a back slap. You just blow their back like that. Usually about 5, you just eat them. Whatever is in their mouth or they're choking on will come off. All right. For the okay, you're asking about toddlers, so most of them, that's what you do. For the older children, you can ask them to cough. Just let them cough it out. If they cough, they will bring out whatever it is they're choking. Okay. But I think for most of those age groups, the most important thing is to supervise them, monitor them. So when they are eating, make sure you cut their food into tiny pieces, and make sure that they are not rushing their food. Make sure they are not getting distracted, like watching TV when they are eating, or anything that will make them not to pay attention. So usually most children will really choke on the food at that age. For toddlers, are children between the age of 1 and 3. So unless they are really taking something that is too big and they're trying to swallow it, and if you just give them a back slap or something, they whatever is in their throat should come off easily. All right. And for the younger infants, those are the ones that we need to be careful. Just make sure when they're sucking, if you notice that they're rushing into something, you have to pause them, let them take a breath, because they need to coordinate their breathing and their swallowing, and then they can now start again gradually. But if a child keeps choking, you have to go to the hospital, because we need to make sure there is no abnormal connection between the throat and the airway. So that is what we can do about that. All right. Let's go on. Oluwamayo going to say asking question on Instagram about vaccine for flu. There's flu vaccine. Flu vaccine is available in the UK, in most countries where they have flu. But we don't, flu is not a Nigerian problem, so we don't need to be taking the flu vaccine. People that give their children flu vaccines, or if they give everybody, including adults, they give them during the flu season. Okay, so it is not something they give all year round, and it's not something you give once and that is it. You have to give it every year at that period when there is going to be flu. So right now in Nigeria, I'm not aware of us having flu as a problem, and I'm not aware of us having that season where okay, so people usually give it like in UK, they give it during winter. So just before winter, everybody is given the flu vaccine so that when we're going to the winter, then you're not likely going to have severe flu and all that. So it's not something we do. We don't do that in Nigeria. So please, just if your child is having catarrh for 2 weeks, go to the hospital, know why your child is having the catarrh first. Okay, that is the most important thing to know. Is your child having allergic rhinitis? What is the trigger? That's what you need to deal with. And if the child has allergic rhinitis, there are drugs that the doctors can prescribe for the uh, for the catarrh. And catarrh is not flu. They are two separate illness completely. So running nose and all that is not flu. Okay, flu is influenza virus. It causes what look like that would be our own equivalent of malaria. You can have cold, of course, but you tend to have more of the fever, the body weakness, and all that. So the fact that somebody is having running nose does not mean the child has flu. No, let's not get it twisted. And it's not the reason why those children should be given flu vaccine. I mean, people that are trying to promote these things in Nigeria, they are trying to sell the drugs. So flu vaccine is not part of Nigerian program on immunization. We don't recommend it routinely. And even in places where they give it, they have to give it every year at certain time of the year. So when they give you once in Nigeria and that's it forever, I don't know what we're trying to achieve. So I'm just going to, I know a lot of, private practice people are trying to do all these things, but there is actually no justification for it. Okay, if your child is having recurrent catarrh and all that, please don't be giving yourself flu diagnosis. Go to the hospital and know why your child is having that diagnosis and get the right support. Sometimes you may have to see the ENT doctors as well. All right, I hope that's helpful. Okay, our time is almost up, but we still have about a quarter of an hour to go. So feel free to still ask your questions and we will try and answer them. But if after now you have any question, feel free to post the questions on our Facebook group or our Facebook. Yeah, usually our Facebook group, we have two or three of them. Actually, we have four of them. We have the Active Pediatrician, which is for the health of the children, and then we have ATP Family, which is for the adults. We have ATP Still a Mom, which is where we support parents who have suffered the loss of children or pregnancies, and then we have First Time Mom. FTM Baby Care Ready group, which is for first time mothers, so that you can have support. And we have lots of resources for first time mothers because we know it's not easy to be a first time mom. So you can feel free to ask your questions on the appropriate group. But don't worry, if you miss it, we'll always let you know which group is more appropriate for you. But our main group is Ask the Pediatricians, and that is where you can post your questions from Mondays to Saturdays, 24 hours every day, and we'll be there to answer your questions. All right, I don't think I have any more questions, so I'll be waiting for the remaining few minutes I have. So if you have any question, feel free to ask now so that you can get a live answer, or then otherwise feel free to post it on our Facebook group. And for all these questions we are answering, if you want to read more about those topics, you are welcome to go to our um, other platforms to watch them. So on our Facebook page, all our videos are there for ATP Live and ATP Hour, so you can watch it on Facebook. I know some people like to stay within Facebook, but you can also go to our website www.axipediatricians.com and you can read all those topics there if you are the type that likes reading. If you're the type that loves listening rather than reading, you can go to our podcast, Ask Dr. Gbemi ATP podcast on Spotify, Google Music, Google Podcasts, Amazon Music, and all that. You can listen to all these topics on immunization, child development, growth, everything complementary feeding. You can listen and learn from those podcasts. And if you also like to watch, we also have them on our YouTube channel. So you can always go to our YouTube channels from you can go to the YouTube channel and watch all the videos, whether ATP Live, ATP Hour, you can also watch. And we encourage you to do that so you can learn. So there are many platforms you can learn from us. And after you've watched and if you see have questions, then you can actually post it on our Facebook group and we will try and answer them. All right, I got a question from Jonathan Magdalene. Good evening, ma'am. My baby breathes so fast when it's playing. It's 10 months old. Okay, and again he snores while he's sleeping. Okay, your baby breathes so fast. So for us, because usually adults we tend to breathe slower than children. So when you say your baby breathes fast, we need to confirm that first because what may be fast for you may be normal for a 10-month-old. So unless you are saying okay, compared to even other children his age, it looks like he's breathing fast. So I will recommend that you see a pediatrician because we need to count how many times your baby is breathing in 1 minute. We call it respiratory rate. We need to know what is the rate. So for a 10 months old, your baby has to breathe 50 times in 1 minute for us to say it is abnormal. So the child has to breathe 50 times and above in 1 minute for us to say it's abnormal for a 10-month-old baby. All right. So because of that, you and actually parents, you not able to count it because some of you can't do the in and the out. So we count only one part of the cycle. So you have to see a doctor, a nurse, a pediatrician. They can examine the child. They can count the respiratory rates first to confirm is the baby breathing fast or not. That is number one. Number two, if the baby is breathing fast, then we want to know why is this baby breathing fast. There are many ways by which we can figure out why a baby is breathing fast. The doctor will also listen to the chest, do what we call auscultation, do examine the child's chest fully. So that will tell them sometimes to give them idea because breathing is not only a respiratory problem, it could be an heart problem. If a child has problem in their heart, so they can breathe fast. They can also breathe fast if there's a problem in their lungs. So that's the job of the doctors. If your child is also snoring, we need to make sure there's nothing blocking the airway of the child. So we need to do that evaluation as well. So basically, this child needs to see a doctor and then they can evaluate the child. Usually, I recommend start with a pediatrician because the pediatrician can do the respiratory rates, they can listen to the chest, and the pediatrician can now decide whether it's something we can handle as pediatrician or it's something that we have to refer the child to the ENT doctors to handle for us. Because of that snoring, we have to make sure there's no uh, swollen, what we call swollen tonsils or swollen adenoids, and then we can take it from there. All right, Jessica Young say, how accurate do we differentiate between speech delay and autism? That is not your job, Jessica. That's the job of a pediatrician, a developmental pediatrician, to say this is speech delay or this is autism because there are assessments that we do that will help us to. So speech delay can happen in on its own, or it can be part of autism. So a child who has autism can also have speech delay. But it is not every autistic child that has speech delay. Some children are speaking very well and they have autism. So they don't have speech delay and they have autism. So it is not all the time, but majority of children with autism will also have speech delay. But it won't just be speech delay. Speech delay is not a diagnosis. Speech delay is just a description. It's just saying this child is not talking as we expect for the child's age. But in children who have autism, it is not only the speech delay that will be there. There will also be difficulty with social interaction. There will be repetitive behavior. There will be unusual behavior. There will be other things that will be there in addition to the speech. In fact, the speech delay is not one of the criteria we need to make a diagnosis of autism. A child can be diagnosed with autism without having speech delay. So it is about the social interaction, it's about the repetitive behavior, it's about all those unusual behavior, all those sensory seeking behavior. Those are the things that we need to make a diagnosis of autism. So a child can have autism with speech delay, a child can have autism without speech delay. There is no confusion about autism and speech delay at all. So it is not something that we struggle to diagnose at all, not at all, because autism is a diagnosis on its own. Speech delay can happen on its own. Speech delay can happen in a child with autism. It can also happen in a child who does not have autism. So, but a child who has only speech delay will not have other behavior. So that child will use gestures. That child will not have repetitive behavior. That child will play with other children, will be interactive. So there are many things that child will be doing in addition apart from the speech. So that is the children where we say, oh, this is just speech delay. But if your child is struggling to interact with other children, the child is only doing one repetitive play, the child is doing unusual things, flapping their hands, walking on their tiptoes, going around in circles, spinning and all that, that is not just speech delay. That is a child who likely have autism. But like I said, it is not the job of parents to differentiate that. That is the job of the pediatrician, preferably the developmental pediatrician, because that is our job, to differentiate a child who has autism from a child who does not have autism. All right, my time is going back. I can see so many people have put a lot of questions on Instagram, and I can't see some of them. Some of them have scrolled past. Somebody has question about the eyes crossed while sleeping. You have to see the eye doctor so that they can examine the child. Somebody said, "Can a child take sobo?" I'm really not sure what is this false about sobo and sobo. Please, I personally don't recommend it. So, because I'm not really sure what is inside. So, there are many other things your child can drink. Let them drink water. Let them drink. Um, if you need to ask that question, then maybe you should just leave it out completely. So that means you yourself you're not sure it's something your child can take. Then just leave it out. Let your child take other water, take milk, take other fruits. That is fine. All right. Oluwamayokun is asking for toothpaste. There's an adult product I recommend using a small size for children. For every toothpaste is a small size. Whether they don't need to recommend that. For children less than 3, we recommend a grain of rice toothpaste. And for children over 3, it is a peanut size toothpaste. So if you want to see that, you just go to our website. We have a article on oral hygiene in children, and there are pictures there that shows you the quantity of toothpaste. So most of these adverts that we watch, and they will put so much toothpaste on the toothbrush, it is actually wrong. It is just a grain of rice toothpaste for children less than 3 years, and a peanut, granules, that peanut size for children older than 3 years. And there's a toothpaste for children, okay? Because the amount of fluoride that children would take is different, and children don't spit out, they tend to swallow, so we don't want them to take too much of fluoride. So that is why you should use the age appropriate toothpaste for children. And even when you are using the age appropriate toothpaste for children, you should still use the appropriate size. Okay. Then Oluwamayokun is asking, is there a reason why toddlers' ears does not grow fast? That is not a standard poll. It's not compulsory. It's not every toddler that their hair don't grow fast. That is just an assumption. So it's an individual thing. It's not, you can't just say toddlers here don't grow fast. It's not a true statement. Some children actually grow their hair fast, some don't. So it's an individual thing, and there's nothing to worry about that. Gift blessing. You've asked your question and I've answered it, but I guess you lost internet connection when I answered your question. Your 14-month-old, we don't have any concern your 14-month-old is not working. But if your baby is not working by 1 year, then you have to see a pediatrician. Okay. Blessing Simon, that's my 2 weeks old is very gassy. What can I do? Are you feeding your baby? So for your 2 weeks old, please give breast milk only. Make sure your baby is well attached to the breast. Make sure the baby is not crying and sucking in so much air, gas before you feed them. And make sure when they're sucking, the whole of the nipple and the areola is in the mouth of the baby. All right, so that is what you need to do. And when the baby is finished sucking, alternate your breast. So most of the gas is from giving formula or giving baby bottle feeding, and they are sucking all the empty bottle as well. The lot of gas in the empty bottle. So those are the things that are prone to baby to being gassy. So those are the things you can do to reduce that. Kafila, we already answered your question about Sobo. We don't recommend that. It's not compulsory for children to drink Sobo. It's not an essential thing for them. All right. Okay, Jessica Young is here asking question. Can speech delay still happen in 22 months old? Speech delay just means the child is not talking according to their age. Okay, so that's explanation should answer your question. So if you see a 20-year-old person who is not talking according to what they should be talking, you can say they have speech delay. Please note that speech delay is not a diagnosis, it's just a description, it's just an explanation that somebody is not talking about according to their age level. So the question now is, why is the person not talking according to what you expect for their age? That is now the diagnosis. Is it an isolated speech language disorder, developmental language disorder? Is it part of autism? Is it part of global developmental delay? Is it part of cerebral palsy? There could be many explanations for why somebody's speech is not age appropriate. So it is not a age thing. Okay, speech delay is just a descriptive word. It means somebody's speech is not, there's a what we expect for a 1 year old, there's what we expect for a 2 year old, there's what we expect for a 3 year old, for a 4 year old, if a 5 year old when it comes to speech development. This is how we expect a 4 year old to talk. This is how we expect a 5 year old to talk. So if that person is not talking the way you expect them to talk, you can describe it as having speech delay, but you still need to know why. Is it just they are just slower, they will catch up later, or is there a problem like autism, cerebral palsy, global developmental delay? Please don't make self-diagnosis of developmental problems. If your child has any issues with their development, please see the right specialist. Okay, if you are worried only about speech, no other problem with that child, see a speech therapist. If you are worried about speech and other issues with that child, you have to see a developmental pediatrician for proper evaluation. Don't self-diagnose, don't self-medicate. All right, my time is up. Everybody is now asking the question now. My time is up. Princess, 7 weeks have cough. What can you give her? Don't give her anything. Keep breastfeeding. If the baby has fever, fast breathing, difficulty with breathing, take the child to the hospital. Please do not give cough syrup. Do not self-medicate babies. Leave the baby alone. Most cough colds are due to viruses. They will clear on their own. But if there's fever, there's fast breathing, difficulty with breathing, you need to take the child to the hospital. All right. Jessica said the structure. No, Jessica, you have to take your child to see a speech therapist first. That child has to be assessed. We need to know what is wrong with this child. And then that is when they will tell you whether this child needs speech therapy, whether this child is having other diagnosis, which is what I'm trying to explain to you. Don't just leave that child alone. If your child is not talking like you expect the child to talk, you have to see a specialist and let them take it up from there. Kafila is saying, what vitamins can you recommend? No, I don't recommend any multivitamins. Let your child take fruits, let them eat vegetables, and they will get all the multivitamins from the food, from the fruits, and from the vegetables they eat. We recommend they eat their vitamins rather than take medication. So I don't recommend multivitamins, except for children who really are very fussy with food. So they are not going to eat their fruits, they're not going to eat their vegetables. Then you can just buy any vitamins you have in the you want to buy. There's no particular brand. You can buy anyone you like, but preferably encourage your children to eat fruits. Give them the banana, the oranges, the apples, the cooked vegetables. Add it to their food. Carrots, peas. Add all those things to the children's food. Let them get used to eating those things, and they will get all the vitamins from there. So unless your children are not eating all those at all, then that is when you have to take them, give them any multivitamins, and you can buy anyone you like in the shops. We don't have any particularly preference for anyone. All right, thank you so much, everyone. My time is gone. People don't ask questions early, and then my time is up. I've got to go. But if you still have any question, feel free to post it on Ask the Pediatrician Facebook group from Mondays to Saturdays, and we will answer your questions. And watch out for us on Thursday. Sorry, last week we couldn't meet up with ATP Hour, but hopefully this week we'll meet up with ATP Hour and we'll be able to discuss another important topic about the health of our children. So till I see you again next week, Monday, have a wonderful evening. Bye bye.